Hello, I'm Dr. Buripek, and today I'm going to talk about abdominoplasty, tummy tuck. And I'm going to try to answer all the questions that you can possibly think of in this video. If there's questions on your mind that I'm missing, just write down the comments. So, what is tummy tuck? Tummy tuck is the operation that we do to take away the excess skin and give you a better body. The abdominoplasty operation takes about 3 hours. Could be a little less or more depending on you. And you're going to have a scar that starts from one side of your belly, goes all the way under to the other side, like a cesarean section scar, which you might be more familiar with, but it's going to be longer. We put the scar in your bikini area, but of course, depending on what kind of a bikini or an underwear you wear, it might be seen. But for a classical standard underwear, your scars are going to be hidden. You will also have an extra scar around your belly button, circular, which usually is very well hidden and almost unnoticeable. And there are going to be a couple of very small stab incisions around your body for the liposuction that we're going to do. So, what you're going to do the day of the surgery, you will come to consultation with me, and we will do our planning and our drawings for the operation, and then I will start talking about the operation. So this is virtually what you will be hearing the morning of the surgery from me. Okay, like I said, operation takes about 3 hours, and like every operation, it has some side effects and it has some rules to follow and it has some risks. So let's talk about those. So you're going to have some swelling and bruising after the operation. We combine liposuction with abdominoplasty. So lipo-abdominoplasty, you're going to have swelling accumulation, especially on the front, on the upper part of your abdomen, in your stomach area, which is going to go away in a couple of weeks. The swelling and the bruising can differ from patient to patient. The more fair-skinned you are, usually the more bruising we're going to see, but this could be very different for many patients. You're going to have the incisions sutured in intracuticular manner, which means there are not going to be any stitches that we are going to remove. They're all going to be absorbable and hidden. You will be wearing a body compression garment, a corset, to help fight against swelling and also give you a better shape, keep your shape, and also prevent against seroma and hematoma, so fluid accumulation and bleeding problems. You will have drains, usually 2 in the front, 1 in your lower back. With the liposuction on standard operation, I take the front flanks and the lower back. We can add the upper back, which I highly recommend usually, because if you are coming in for a tummy tuck, you're probably going to need a couple of extra things around your body as well. It's unlikely that the only problem is the tummy, so we can combine whatever else you need during this operation. We don't like to go over 6 hours of operation time as much as possible to decrease the risk of anesthesia and the operation in general. So we can add 1 or 2 extra operations and make a combination depending on you. So you will be walking in a flexed position for 3 weeks. You will be walking in a flexed position for 3 weeks after the operation. So I want you in a 30 degrees bent over position from your waist. Well, I'm going to take away the excess skin and I'm going to make it very tight to get the best possible outcome. Thus, if you just straighten up right away, you're going to put pressure on those stitches. You can pop them open. Your wound might open up. If nothing happens, still, pressure is the #1 enemy of scarring. So if you put pressure on the scars while they are healing, if you pull them apart, the scars are going to widen and heal in a worse condition. So I want relaxed scars, so bend over for 3 weeks for the most active healing period. And after that, you will be straightening up And in 3 weeks time, when you walk straight and the swelling goes away, you're going to see your beautiful results. So you will also keep that position while sleeping, bent over. The beds in our hospital are going to be motorized, so we will give it a position and flex the bed for you. But when you're home, what you'll do is use some extra pillows under your legs and behind your back. So 2-3 pillows behind your back and a couple of pillows to put you in a V, a flex position. Well, 3 weeks passes real fast, don't worry. Pain. When you're in the hospital, you're going to get triple painkillers, non-steroidal, anti-inflammatory drugs, paracetamol, plus narcotic painkillers, and of course there's not going to be a possibility of zero pain. Every operation is painful, but this is going to keep them to a minimum, and usually patients tolerate this operation very well. After you go out of the surgery, the first half an hour you will feel cold and shiver, and we're going to heat you up, and once your body temperature returns to normal, you will start to feel better. So just the first half an hour, a little bit cold, a little bit drowsy, just trying to wake up, and after that, usually you're going to be all right. You will be walking the night of the operation. Usually put a urinary catheter, and I like to keep it the first night because I need to hydrate you a lot after the operation, because you're going to lose a lot of fluids during the operation. I will be doing lots of liposuction, and you will be losing tissues. Thus, you're going to need a replacement of all the fluids that you lost during the operation. So, which means you will be urinating a lot. So I don't like you going to the toilet every hour. Well, even though you're going to be walking, it's going to be under control with the help from our nurses. And after your first day, 1 or 2 nights of hospitalization, and after that I'm going to let you go to your hotel or to your home, depending whether you're coming from another city or country. And after that, you will come for checkup. The checkup, usually we do it 1 or 2 days after your release from the hospital, and on your checkup we usually take out your drains. We can take them out all at once or remove them one by one, depending on how much they bring. Your drains will stay for a couple of days, 2, 3 to 5 days maximum, depending on how much they bring. And how much fluid that the drains collect depends on you. It depends on how much liposuction we made, how big of a dissection area you have, and many other things. And it's alright, even if they bring less or more, the maximum is 5 days. They're just a bit irritating, but don't worry about the drains, and pulling them is not going to be painful. I can promise you that. So, let's talk about risks. What are the risks of the operation? So, 1, anesthesia. You're going to be under anesthesia, and this is a big operation, not a small one. And with anesthesia, you can have, God forbid, but even fatal complications. But for most of our patients, this is going to be very minimal. That's why we make blood tests before the operation, and our anesthesia doctor sees you and examines you to see if you're fit for the operation. And if you are, then if you're safe, which means ASA 1 or 2, which is very safe to operate on, then we will be operating on you. If there's any risk factor to your operation that prohibits us from doing it, well then we won't do your operation. Because at the end of the day, this is an aesthetic operation, not a must. So your safety is our priority. What else? The anesthesia complications include lung complications, adverse or allergic reactions to the drugs, embolism, thromboembolism or fat embolism, and postoperatively atelectasia or pulmonary edema. Now, these are the most common things that we see after these operations, but these are not very common. These are very rare, but if we see a complication, these are one of the events. So we take precautions for everything that can be taken. And you're going to wear a compression sock to protect you against a thrombus formation on your legs, to protect against embolism. We have pneumatic devices doing the same during the operation. Our anesthesia team takes every precaution and due diligence to keep your metabolism under control during the operation to minimize the risks. So basically, even though there are risks, this is a very safe operation. What are the operational surgical risks? Well, common risks for all operations include bleeding, infection, and wound healing problem. Now, bleeding risk is under 2%, so very safe. 98%, you're going to be fine. But 2%, of course, there's a risk of bleeding. You might cough, you might push yourself, you might have a blood pressure increase after the operation, or if nothing happens, it just can happen. And you might have a hematoma. Now, the reason for keeping you in the hospital for 1 or 2 nights is, well, one, you need to be fit enough to, well, go out of the hospital, of course, but also to keep you under observation, because if a bleeding happens, it usually happens within the first 24 hours. It's very rare to have a bleeding after the first day. So if you have passed the first night and the first morning, most likely you're going to be fine. Yes, you might have a bleeding hematoma in an induced setting, which means like if you cough, if you force yourself, if you walk or run or push yourself too much, yes, you might cause a bleeding, but you should be resting after the operation to prevent this anyway. So follow the rules and you're going to be fine. We have 24-hour observation in the hospital, so you will be under observation to keep a track of any hematoma or swelling, any complication. If it happens, of course, we might have to reoperate on you in an emergency or a semi-emergency setting to stop the bleeding or just evacuate the blood. But for this operation, usually it bleeds and stops, but you need to take away the blood. You can't let the hematoma sit there, so you take the patient, double check, and do a bleeding control, and then do a small operation to take away the hematoma. Even though I talked a lot about this, this is a rare event, again, less than 2% for overall patients. With any body contouring operation, there's a risk of blood transfusion after the operation. We don't operate you under a certain limit of hemoglobin levels because, well, you will be losing blood during the operation, at least a bit. But it's usually minimal and very well tolerated. But again, there's always the risk of blood transfusion with these operations. Infection. Every surgery has risk of infection. Even though this is a clean operation, I still prescribe prophylactic, protective antibiotics after the operation. During the hospital, you will be having them IV intravenously, and after discharge, you're going to be using tablets for about a week to 10 days. Wound healing problems can happen with any body contouring operation. Usually with tummy tuck, we see it rarely. Usually heals very well in 2 to 3 week period. Your wound care is very easy. Until your drains are out, I will be doing your wound dressings anyway, so you can just relax about that. But after that, you will be having a sterile strip wound care on all your scars. You will keep those strips for about 2 weeks, and after that I want you to use a antibiotic cream over the scars for about another week, and after that you should be all healed up. So we're gonna be starting our scar treatment, which will be a silicone gel or a silicone tape, and you will be using that for 3 months. One thing, there's that can happen in your 2nd to 3rd week period is seroma, which is the fluid accumulation in your body, in the operation area. To prevent this, I need you to wear your compression garments in a very tight setting, as tight as you can tolerate. You will be wearing those compression garments for about a month, non-stop, 24 hours a day, 7 days a week, except for showers. And massaging is recommended after the operation for swelling reduction and for a smoother result, and also prevent against seroma formation. You can start your massages in tummy tuck after the drains are out. Depending on the patient, usually you can start them in your 1st week. All right, so this covers the basic risks of the operation. Body sports. So walking, you will walk the first day and you will be walking after the operation, but walking as in half an hour, power walking, walking that causes your heart rate to go up, you can start that in usually 3 weeks, maybe 4-week period, depending on you. And you can use lower body or upper body equipment usually in 2 to 3 months, and abdominal core exercises or any exercise that will contract your abdominal core, you can start that in 3 months. Because we're going to be suturing up the rectal muscles, your rectus muscles, the rectus abdominis muscles, you will need to let that area heal up first before you're using your abdominal core again. If you have hernias, if they are small, we can repair them during the operation. If they are very large, well, then you need a consultation from a general surgery before that. But usually hernias can also be repaired during the operation, and this applies for 95% of the hernias there. For small hernias, the rectal application and direct repairing is a good solution. But for a large hernia, we might need to do something more extensive. There's one little thing that we need to discuss about hernias. If you have a umbilical hernia, the way to repair it would be cutting through your umbilicus, and that means your belly button, your umbilicus, will be cut away. So we will be creating a new umbilicus for you from scratch. Still will have a very good look, but your original belly button will be gone and we will create a new for you. But this only applies for the umbilical hernias, not the other ones. Normally what we do is we cut away the belly button from the skin, so it's going to be separated from the skin, and when we take away the excess skin and pull your belly downward, we open a new hole to your belly button and take it out. We can do a little bit of sketching to your tummy as well. What I mean is we can do the liposuction in a selective manner and give you a more muscular look during your abdominoplasty. But it kind of depends on you. If you're overweight, then we might not achieve this. And the operation limit to tummy tuck would be 35 BMI. So body mass index 35 is going to be my maximum that I operate on you. But again, this needs to be discussed and it kind of depends on the patient. Overall, so what is going to be my limit for operation? Well, body mass index 35 and above will not be eligible for operation. Between 32 and 25, we will be having the best results. If you're between 32 to 35, it's a little overweight, but still can be operated on. So for a rule of thumb, the lower your BMI, the better results you're going to have. Because when you gain weight, you just not gain weight on your tummy, on your subcutaneous fat, but you also gain weight in your inner abdominal fat, which is something you cannot change. With rectus plication, we kind of decrease the intra-abdominal volume, but you can only do it up to a point, not too much. So even though plication is going to be helpful with decreasing the intra-abdominal volume, it's not going to be a very strong force. So running water is all right after the drain, so 3 to 5 days. Thank you for watching, and if you have any other questions, just write down or ask to me and I will be adding them up. Thank you.